Hello, and welcome to Biopharma Talk, a series of conversations with professionals in the regulatory, quality assurance, and biopharma world. My name is Al Rejekis. I'm the Director of Marketing at Biopharma Institute. Biopharma Institute is a leading provider of online training solutions for employees, management, and affiliated staff to learn and be aware of current regulations, guidelines, so that they can perform at their highest level to achieve full compliance with any regulatory issues that may occur. This morning or this afternoon, we have Roland Strickland as a guest. He is our Director of Regulatory and Quality Assurance at Applied Biocode. So welcome, Roland.
Hi.
Hi. So I know many of you and your colleagues a lot of times spend a lot of anxiety over three letters, FDA, and maybe the state equivalent or some other regulatory body that may come unannounced to say, hi, we're here. And I'd like to get some of your perspectives and past experiences of what you may have observed with how to best deal with FDA inspections, whether they're formal or informal, and things to be aware of and how to best prepare for that, and what's best to be done with not just you as the potential target of such an interview, but also your fellow team members.
Well, the first thing to be sure of being successful in one of these inspections is to make sure that you have a process in place to actually deal with the inspection. So this should be kind of like a written SOP or something or other that everybody's trained on, so that everybody knows what to do when the inspector or auditor shows up at the door. So typically you would make sure that they show you their badge and show any documentation they have that says that they're there to inspect. I believe it's 482 or something like that. So then you would have a place ready to go for them, to kind of like a quiet room out of the way of the general office staff, and also any sort of operations, manufacturing or quality operations going on. So ask them to sit down in there. Have a sign-in sheet ready for them and anybody else who they call in there, so that everybody who is involved in the inspection, it's documented. Then there's kind of like the nuts and bolts of it. You want to have kind of like a what we would call a front office, back office setup, so that when FDA is asking for documents or something like that, that you have somebody kind of maybe in document control or something other like that, ready to gather those documents, so you're not running back and forth. So you have kind of like a person in the back office collecting documents, writing them down, so that you know that what they've looked at, and then have kind of like a runner to run the documents in there.
Right. So Roland, it sounds like when you have such an event occurring with the FDA knocking on your door, hopefully it's maybe been pre-announced and they're coming. But basically, you welcome them. You want to make sure they're authentic, and you are in a quiet environment so that you can have a reasonable discussion. Probably sounds like it's important to have an upfront understanding of what the objective is of their visit. So if it's to review certain documents or to look into any specific areas, whether it's related to something operational, or maybe it's related to supply issues or whatever, because a lot of that can change with time. So obviously being on the same page is important. Don't assume that they want something that they don't want, because that can obviously lead down a path that you don't necessarily want to go down.
Yeah. kind of like the key points of your procedure too is only answer yes or no if that's,
if you can.
Only answer the question. Never volunteer any additional information. If you don't know the answer, you tell them that, and you say you'll try to find out, and then you try to find out.
Right. So it's okay to, like you said, just answer what you're asked. If you're asked to bring documents of a specific nature, just bring those documents. You don't want to offer anything else.
No.
It's okay to offer them water or refreshment, but not, oh, here's some other documents I have that I thought you might want to see because there's something fishy with them.
In the case of FDA, basically you can't offer them anything except for water.
Okay.
Sodas, chips, none of that stuff. They're not going to take it in. So you can offer it, but typically they will have brought their own. So yeah, I mean, it's the polite thing to do to ask if they would, if everybody is drinking coffee and there's a coffee carafe or whatever, you can mention it, but they're probably going to say no, thank you. As a matter of fact, they're going to say no, thank you. That's kind of that's their procedure.
Okay, so basically, I was a little mistaken here. Don't offer them anything unless they ask for it.
Right. I would offer them water. I mean,
okay.
But if they brought their own, then they'll let you know.
Okay. So what are some other pitfalls? What are some other, I don't know, do's and don'ts or things you should be aware of while the FDA is there? Obviously, you're there to serve them, to provide answers that they're looking for, because that's why they're there. If you frustrate them in not answering questions at all and, trying to stonewall them, that's probably not a good tactic.
No, you don't want it to be a hostile thing. Most of the time, they're polite, they're correct. I want to say that there's two different types of inspections. There's kind of like your standard. I'm going to call it like a general surveillance inspection, but also there's also inspections for cause. So if they're there because there's been complaints or something other like that, or recalls or something like that, then the tone kind of is a little bit different. But most inspections, routine inspections, follow kind of a certain cadence. They'll come in, they'll want to meet people, they'll write down names and things like that, who they talk to. There's typically things that they'll want to ask for. I mean, first off, there'll be things like the quality manual, and then they'll probably ask for things like a record of your last management review and any sort of audits. You don't want to volunteer to show them the actual audit or management review notes or anything like that. You should have kind of like separate documents that state, okay, this was the day that we had management review. These were the people that were in attendance. They have a sign-in sheet. These are the topics that were discussed, and this is when it ended. You don't want to show them anything else that they're not supposed to ask for it. Anything like that, though, can really open up a door that you don't want to look into. Shows that you had scheduled audits, you had completed audits, which areas were audited on which dates, who did it, but you don't want to show anything that actually happened during the audit. Audit records are outside of the scope of their inspections.
So Roland, it seems like you raise a point where there's a real value for all employees, not just people that may be meeting with the FDA, but part of any organizational or operational team, whether it is an operation, shipping, receiving, R&D, quality assurance, the whole spectrum, that they have some basic awareness of what are some of the basic requirements for the company to meet. And I imagine companies usually have training programs set up for that. identifying key functions that should be trained in different areas so that they're fully cognizant of the regulations and how to properly do their jobs in those areas. Can you comment on that?
Well, any, especially manufacturing company, there should be as part of the training program, an awareness that how they affect the quality of the product, the quality management system, or any other processes. So these people need to know that they are held up to a high standard because of, because the company's manufacturing medical devices that
Right.
everybody's held. So, and that could be anybody in the company. That could be the document control clerk, the contracts person, or whatever. Anybody that touches anything to do with the product needs to have some sort of basic training about how they can affect the quality of the product. So, and part of that training then is also what we're talking about, this procedure here on what to do when people come in for inspections.
Mm-hmm.
Everybody, even the receptionist or whatever, especially the receptionist, should know what to do in case an inspector or an auditor shows up.
Mm-hmm.
So that's kind of like one of the basic training things there.
Right. And obviously, as part of the training programs, there's usually a requirement to maintain records of who attended what, when, did they pass, if there was any kind of exam or quizzes given during the training. And those records are fair game for these auditors to ask for if they feel it's warranted, right?
Yeah, exactly. So it's pretty much a requirement that regular quality system training is conducted, and that is kind of a requirement of both 21 CFR 820, the FDA quality system requirement, and also 13485, which is the ISO 13485, which is the standard for the ISO standard for medical devices.
Mm-hmm.
So the training should be held at least every year, and more often if necessary. But at least once a year, everybody should be trained in the basics of the QSRs and ISO 1345, and also, I mean, kind of like the things to look out for, the things that an inspector and auditor for, and what might happen if things go wrong. So typically, people will know that if some sort of failure or whatever, or nonconformity, that there's going to be a notation or whatever in the audit record that the inspector or auditor is preparing. So they need to know that their job not only is important as a function of the quality of the product, but also the kind of the outcome of the company's success. So
Right.
if you make mistakes, they can do things like warning letters and seize your product and shut you down and put people in jail, depending on how egregious the act that you have performed is. So.
Right.
Yeah, so people need to know that what they do has an effect both on the product and also the company.
Right. So obviously you want to avoid those worst circumstances. Jail is not a pleasant place for most people. So, what was I going to ask you here? Oh, so as far as the training records or the training programs, many companies have established their own documentation for how you train employees with whatever frequency, like you said, maybe it's annual, maybe semi-annual. And for larger companies, they have usually resources of all types, director of training, monitoring and compliance. And actually, Biopharma Institute plays a role with companies both large and small, where we provide a whole catalog of courses that could be specifically targeted to specific functional groups within the company, where the content is provided online so that your employees can take a particular training that's half an hour or an hour, say, complete a quiz, and then there's a complete documentation that, Roland Strickland, for example, passed this particular training on today's date, et cetera. So that helps streamline the bookkeeping process, particularly for smaller companies that, maybe a lot of people are wearing several hats. So you need to make sure that you're wearing all the hats at the right time.
Yeah, a lot of small companies, they work on kind of tight budgets, things like that. So, they can't afford to have somebody who's full time just doing training. So it's usually a shared thing. But
right.
Have adequate documentation of training, and that it's available for review as necessary, is key. As I was talking about, kind of like the steps to, especially like an FDA inspection, they'll come in, they'll want to talk, meet the people, ask for a few regular documents that they'll always ask for. Is almost always like the quality manual, and also records of your last management review. And then they will, typically ask for a walkthrough of the facilities. And during that walkthrough, especially if people are doing something, they have the authority to just stop and ask anybody what they're doing. And so they'll ask people, it's typically, what are you doing? How do you know you're doing it right? And typically you're supposed to say, well, I was trained to do this. And then they'll say, well, I want to see the training record. So make sure that people's training records are kept up to date, and that people have been trained for the processes that they're conducting. And then after that, they'll probably want to see products or things like that, and then they'll ask for documentation for typically a product line. And a lot of times that will be whatever the biggest seller is in the company. So, I would say if you have to focus based on resources, focus on documentation for your biggest seller, because that is what FDA is going to come in there, unless there's something that has a lot of complaints. And that, right. So anything that's the biggest seller, anything that's been subject of a recall or a medical device report or something or other like that, those sort of things should have extra scrutiny. And once they start down that path, they'll look at a product or something or other, everything from the raw materials that went into it, the supplier of those raw materials to make sure they're qualified, and all the way the steps through the processes, manufacturing processes, QC processes, before it goes into packaging and final approval and goes out the door. Anything along that path, they can look for the documentation for that, and they'll ask typically one or two people that their names are on a document. They want to see their training records.
Right. So I know you mentioned earlier, the quality manual, they may want to see that it's up to date. And obviously with any document of that type, it typically undergoes revision and improvement and signed off by management and different representatives. So in a way, that's kind of showing, your own quality improvement processes in place by having these amendments to the quality manual. A lot of people may think, well, if it ain't broke, don't fix it, but everything can always get better. But obviously within FDA regulated products, you can't just go ahead changing processes here and there if they've already been approved, unless you have documentation, whether it's a clinical trial or some other formalized study that this will actually be a better product, higher purity, higher performance, or whatever the case may be. So any closing thoughts you might have?
Yeah, you have to validate any changes that you make. That's a big part of design control.
Right.
And also you kind of you learn from your mistakes, feed that back into the system to improve it. Continual improvement is a goal of any company, which kind of sets up a little bit of a dichotomy in that FDA doesn't like to see a lot of changes to products that have been cleared or approved. unless there's a good reason for it, and
Right.
that you've done a risk analysis or something or other to see what this change might introduce into the system, and that you've validated everything in a written document.
Right. Okay. Excellent. Um, so I guess we'll kind of close out this session today, and thank everyone for joining us. If any of you have found the contents useful or would like other topics to be covered by the Biopharma Institute Talk series, feel free to contact us on Twitter or Facebook, and we'll try to accommodate new topics as they may be ones of interest to you and your colleagues. So again, thanks again, and we'll look forward to seeing you next time.
All right, thanks for having me on.
Yeah, thanks, Roland.